And here, first I am coming to neurodegeneration, and my PG thesis was neurodegeneration particular to Parkinson's disease through Rajata Basma, and particular, and it was in 2002 as you told earlier. And after that, I treated many cases for the Parkinson's as well as Alzheimer's. So based on that things experience only, I am putting some of the my views here. Neurodegeneration diseases are caused by the progressive loss of structural functions of neurons, including neural death. Of course, it is a part of midbrain that considered, and uh,
Hello.
there are currently millions of people affected as a population ages. These diseases are incurable, resulting in the progressive degeneration. And
Hello, sir. You can continue, sir.
yes, yes. Uh,
Next slide.
Next slide. Just a minute.
Okay, sir.
Outlook. The main diseases are coming under this part, that is Alzheimer's and dementia, Parkinson's, MND, and PSP, progressive supranuclear palsy, PSP, and multiple sclerosis. And the main symptoms are memory loss, forgetfulness, apathy, anxiety, agitation, and loss of inhibition, mood changes. These are the things you can see, and I think many of the doctors are they seen that one. Alzheimer's disease, 43 of people are above the age of 83 years, 43%, and PD is 3% of population over the age of 60 years. You see the magnitude of that disease. By the year of 2050, nearly 400 million people are 80 years old among world population. You see correlation and you think 930,000 people in USA with the PD in 2020, and 5 million people are with the Alzheimer's disease in 2016. This is the statistics of the US and India. PD statistics is not available, even though some areas are this available, but all over India it is not available. Symptoms, and general symptoms we can see as a neurological disease, any neurological disease. These are the symptoms we are going through that, and not specifying the disease, rather the symptoms only we are considering that it is this: fainting, dizziness, seizures, headache, speech changes, and vision, tremor, weakness, and wasting, and paralysis. These are symptoms we are seeing in the patients. And pain and numbness is, of course, it is the areas we have to consider. And tingling, memory loss, we have to, memory loss is, of course, it is, we can see the neurodegenerative cases, neurological cases also.
So you can
I think
change to the next slides.
the slide is not changed, that is why, right?
So you can use the navigation keys, sir.
Navigation.
4 keys in the keyboard, sir. You can also use that. Okay, sir. Changed.
So the treatment aspects, it is I'm just presenting this for getting the idea. First symptom of the disease developing only after the degeneration of 40% of the cell damage. That is cell degeneration of 40% of cells. You just imagine, our 40% of cells is damaged, then only we are getting the first symptom. Then what is the use for treating after that? So of course, when we are considering the neurodegeneration, we have to how to avoid the degeneration. That is the preventive aspect is more working in this area. After the degeneration, it is the once it is neurons are degenerated, never it can be regenerated. So the whatever the treatments, not considering other, compared to other diseases, whatever the treatment, we are aiming to stop the further degeneration of the neurons. So uh, when we are talking about this disease, particularly in this era, the what are the food habits and what are the aharas and viharas and chinta, these three things we have to be considered in this point of view. That means the treatment is started after getting the symptom is having a similar effect in the body. Many of the earlier symptoms as anosmia in PD are neglecting by the patient. Anosmia, first it is symptoms of anosmia, but many of the people are not knowing this is the starting stage of PD. And even we are also not recognizing it is the, because many of the, while sitting in the OP, this condition we are neglecting. But when we are sitting in the OP, especially the aged population, this question should be asked. Anosmia should be, we have to rule out. So the options of the treatment are based on the work and age. We can categorize the possibilities of neurodegenerative disease in future. For this, we have to give awareness about this disease to the people. By that, we can develop a preventive techniques. That only I'm saying. So preventive technique is a better option. So by that, we are just coming to the Rasashastra side, because this is the two things. We are using the Rasashastra medicine, the neurodegenerative diseases, along with Panchakarma treatments. So when we are talking about the Rasashastra, this Rasa medicine as a main we are giving, or medicines as a part of prescription. Just example I am giving. Dadimashri with the Rastindura is one of the combination we are using for the IBS. So it is along with the Kastaushadhi we are giving, and another in Haridraganda with Talasinduram. That is the as a part of prescription we are giving. And the Rasa medicines we are just Brahatwadindavani, or as a main we are giving Brahatwadindavani or Yogendra Rasa, like that. So when we are talking about the Dasyastra, we keep in mind the digestion of the drug is important. So just example, the loha is more than 1500 degrees Celsius melting, and it will melt in Triphala churna. So the loha, if you are giving along Triphala, the digestion will be more proper. If you are giving the copper along the sulfur, sulfari, the copper digestion will be proper. So otherwise, in antidotes, we are thinking about jackfruit. If you are taking jackfruit, if it is raw, I mean, so it is marija or shundi is the antidotes. Along with shundi and marija, if you are taking jackfruit, digestion will be easier. And karaskaram, if you are taking the karaskaram, if you along with the curd, if you are any doshas to avoid the karaskara poisoning, we are the antidote is curd only. So digest of the things, just putting the slides for understanding this. Whatever the different medicines you are giving, whether it is digested or not, otherwise it will create the problem. You may be asking toxic effects only. For avoiding that only, I am talking this digestion is important. If digestion is proper, of course the different medicine will create the toxic problems and benefits. Do only that which benefits the patients. While treating the patient, the aim is like that only. Honesty, don't play games. You have to tell the fact and what I am going to give, and without saying the medicinal name, or should not give to the patient. Inform and educate the patients. That's very important. These are the effects we'll be expecting from this condition, and while taking this medicine, if any problem other than these effects, of course you have to report as early as possible. That you have to tell to the patient. And confidentiality is the main thing, and should not forget about while treating the patient. These are very confidential. And by that, I am categorizing the whole Rasaushadis into three categories. One is Deepanavajaniya and Samchamaniya and Rasayaniya. What we are studying in the our syllabus or the in the curriculum, there are nearly more than 52 Rasaushadis are there. Individual Rasaushadis, I'm talking Maharasas, Uparasas, and Sadhanasas, and Doka, Upalohas, or these Sigadavarga and Sudavarga, and total, and of course, upper side it is, and boom side it is coming to the Mercury. And so these are all together is classified into three categories. One is Deepanavajaniya and Samchamaniya and Rasayaniya. Classical forms, other classifications we can see classical forms and patent forms. And other classifications we can see single drug or compound drugs. Because why I am saying these things, then only we can understand this one. And first one is Deepanavajaniya. Of course, all the Sudavargas is coming under Deepanavajaniya. You may be seen all the many patent forms. One may along the different ingredients. One drug will be Chankavasma or Varadikvasma or Kukudandatok like that. That is not because of the improving the calcium in the body. This is using as a just an Jeevana and Pajana effect to the particular drug. Then only the drug will be properly digested and assimilated to the body. And while explaining these organs, all these calcium carbonate for drugs are Ushna and Virya, but expect only Pravalabasma is Shida and Virya. That is keep in mind. All are the Ushna in nature, and Pravalabasma is only Pravalabasma is the and Shida in nature. That is why it is indicated in the leukorrhea. Okay. So other thing is Samchamaniyam. So this drug we cannot give in continuously. Maximum days is only 7 days. Or pacifying the symptom, up to the pacifying the symptom. Should not give more than 7 days at a stretch. Especially the arsenic compound. We are studying the three arsenic, that is AS2, S3 is Haridalam, AS2 is the Manasila, and AS2O3 is the Malla. So Malasinduram, Dalasinduram, Shilasinduram, and Shodhida Hingula is also coming under this Samshamaniya. And see, these should not be given more than pacifying symptom over the maximum 7 days. So another category what we are giving, especially in the case of neurodegenerative diseases, it is the Rasayanium or Rasayanam. This one is main is the Maharasas and Shuddhalohas. Is coming under the these Abharavaikranam Vachikam. This everything is coming under the Rasayana Varga. That we can give up to 1 mandala or 41 days we can give. And after that we can break the condition again. After 10 or 15 days again we can start like that. Because periodical intervals are necessary. Because once the medicine is not absorbed, it have to give the time to eliminate from the body. So once it is not absorbed, better to eliminate. So give the intervals, frequent intervals while giving the results is a very important thing. Okay. So Abraga Basma and Swarnavashik Basma, Shilajit, Swarna Basma, Tajata Basma, Tamra Basma, Loha Basma, Sindura, Siddhamagarada, and many single drugs as well as the compound drugs are coming under the Sinai group. And we are giving these medicines, many of the doctors, and we are prescribing for 1 mandala or up to 1 mandala, or after that we are breaking, and again after giving 10 to 15 days, we are giving repeating the condition. Okay. So these are main classification. So all the drugs are coming under these 3 categories. So another classification I am putting in, this is my classification, that is the we are putting into the 6 categories of the Rasaushadis. One is the Samira Managarasa, Egangavi Rasa, Yogendra Rasa, Brahatwadindamani, Rasaraja Rasa, and Kumara Kalyana. These are particularly we are using the Vada disorders or neurological disorders, degenerative as well as non-degenerative metabolic disorders. And another category we are using that it is the um, Sindhura and Siddhamagaraja and Malla Sindhura. These are another category we are using. And third category is the Sangavasma and Pravalosma. I am giving us other calcium compounds also coming under third category. And fourth category is Maharasas, again coming to Maharasas and Lohas. Abravasma, Swarnavasma, Rajatavasma, Tamaravasma, and Swarnavasma. Particularly, I am using these five basmas. And in the tablets, I am using the Vadagajakusha, Trayodashangagulu, Vadarasa, and Mahavada Dumsaras. And in the Lavanas, Saindam, Samudra, Savartil, Bidansa, all five Lavanas are using particular to selective conditions. And these are the, I'm classifying these categories because based on the disease only we can say like this. And particularly, I'm giving one, putting one slide that is very simple slide for Pachagada we are treating. That is Egangavirus is for Langanam and Ardhidan Pachagada we are giving. And Vasandamaladiras is Pachagada with diabetes mellitus we are giving. Drahatvadi Indamani we are giving Pitanivanda Pachagada and spinal cord lesions we are giving. Then Yogendrasa we are giving the Kabanavanda Pachagada and BMD we are giving. That is the Rasarajrasam we are, it is especially Brahmanam and Ardhidam Pachagada and particularly to Parkinson's disease, Kumara Kalyana Pachagada in child we are giving, or the neurodegenerative in child we are giving. So these neurological disease, once in a suddenly what we have the view, that only I am expressing that. So, by that, we are coming to the particular to Parkinson's disease, one of the main disease in coming under neurodegenerative disease. Particular this condition I am taking because I have much experience on this condition. And the possibilities and limitations, that are also very important because when we are treating the Parkinson's, we cannot completely avoid the modern medicine because we three varieties of cases because initial stage we are getting the cases and after taking the along with the modern medicine we are treating the medicines and if modern medicines are getting the adverse effect then we are patients are coming to the Ayurvedic side then that type of patients also we are getting. So limitations are there and possibilities also there. Of course, while treating this case, Parkinson's, you have to keep in mind not to curative, but to care. Of course, we cannot assure we are cure the condition and by that you that admit the patient to the 41 days or more than 2 months. Not like that. You have to understand that and you tell that it is caring is very important. Save the patient from the cracks. Of course, I am explaining because many of the areas, especially in the Ayurvedic side also, they are treating this and taking lot of money from the patient also after that only they are recognizing that it is not able to cure like that. Rate of incidence is high that I told earlier and proper clinical experience is needed because otherwise it may be we are confusing or mimicking the condition. Many other than idiopathic Parkinson's, especially some tumor is in the brain or the even first stage of the some conditions of these hemorrhagic cerebral hemorrhagic condition. We can see the symptoms of Parkinson's. That will be easier to understand and better treatment is needed and it is curable also. Neurodegenerative diseases and research is needed, of course, research is needed. And of course, Rudu Shodhanam is as a preventive aspect. If you are doing the Rudu Shodhanam, we can overcome the many diseases, even the neurodegenerative diseases. So if you are every year, if you are doing or asked to do patient to a patient or person to doing the Rudushodhana, that is the in the starting stage of Vashrudus, if you are doing the Vasti or in, say, starting stage of the Sharath if you are doing the Virejanam, or before the Vasandarudu if you are doing the Vamanam. We can overcome the Vata Pitta Kapha, and by that we can intestine system will be proper, and absorption levels will be proper, digestive levels will be proper, and by that we can overcome the disease aspect and have improved our healthy and immunity aspects. Samprapti is Parkinson's, Vata Pitta increases, Ushna and Duksha is directly increases. Maybe that is the Avarna. Indirectly, it's Avarna is having the role. Some cases, so Avarna leads to the Vata Pitta increases. And Kapatshaya is the another area because of Kapatshaya, Vata Pitta again can be increased. And Majja is Kavasthana. And brain is considered as the Majja Sthana or Majja. So Majja is Kavasthana. In the disease happening in the Kavasthana, of course, it is the Chikitsa is Dusadhya or the Chitrasadhya. Asti Majja, because Kava is the stability of the body, and our stability is decreased, of course, the disease will be more prominent. And Asti Majja Shukra, that is Gambhira Dhadus. It's affecting the Asti Majja Shukra. Once the disease is affecting the Gambhira Dhadus, of course, again the Chikitsa Vaiduthyam or Chikitsa difficulty can be seen. And of course, we are considering the Sira, Rasadhadu, and Manchadadu, and Shukradadu, and Snayu, and all this. How? Siras, Sirogata Majja, Mastishkam, Asraya of Kaba, it is as per the Dalshana. Siras is the seat of mind, according to Bhela. So mind will be affected in the case of the Parkinson. Even though we cannot see the dementia or memory loss in the Parkinson in the early stages, but due to the medicines as well as the our psychological features leads to the some memory loss. That's all. Otherwise, just you see if the damage is happening this side, and if it is damaging is happening to the substantia nigra or the globus pallidum to other side, of course it leads to Alzheimer's. Very minute changes. And degeneration is only the change of degeneration leads to the entirely different symptoms, even though the degeneration is common factor. Pranavayu, it is mind, and Buddhi is the Sana, and Tattva, Kava is the seat of Siddha. So these all are affecting the Parkinson's, and by that these symptoms, Kavashaya, Tattva, Kavashaya, Indriya, Chinada can be seen in this patient. Majja, Majjashaya, Sukralpada, Vishne Samshosha. This Parkinson's patient may be having the sexual outfit very less. Yes. That is audible? Not audible.
Yes, sir. Yes, sir. Yes, sir. Audible, sir. You can continue, sir.
If it is too fast,
No, sir. It's proper, sir.
Majjavadurvada is the phenomenon and Parivashtam and Sputa. These are correct heals of Parivashtam and this phenomenon or the bending nature, we can see the condition because Majjavadurvada condition. So Snayu originates from the Mastulangas and Mula, that is also according to Kashyapa, and it is Upadhatu of this Medodhatu, and Sthayigatavada, Tamba and Kamba and Stula and Akshapa is Nidan, it is explained. So it is we got to see Sthayigatavada also we have to consider in this area. And Dasadadu, Dasada Kambam, Sitpida and Shunyata is Ashtanga Sutram. This even though it is not all the conditions, psychological tremor also can be seen. If patient is walking, suddenly getting, or somebody is looking on this patient, of course, patient will be more getting more combust. Affecting the Rasadadu or the Manas. Shukradadu, Shukrashaya, and Kamba is another symptom. And this is very evident in the case of the Parkinson. Shukrashaya will be there, and Shukrashaya Lakshanas will be, we can see, observe the patient. Causes, of course, all these are again with the and it will be mask-like, and Oji with some trauma and inability to perform functions. So these can be, we can very clearly we can see in the patient. And we are also seeing this type of symptoms in the patient. So differential diagnosis, of course, I told you diagnosis is very important, even in the Parkinson's itself. Idiopathic Parkinson's, that's when big category we are putting, and we are talking about the condition. The cause is not known, or cause is unknown. And drug-induced PD. psychotic drugs, reserpine and this metachloride is using continuously use leads to the Parkinson's. I treated this condition in the Ayurvedic pharmacy hospital itself, and he is having good results compared symptomatic improvement is there, and the patient is from the Polach. And vascular PD, cardiovascular diseases, it leads to the vascular supply will be less and leads to some tremor and condition that also can be corrected. An essential tremor, no responsive order. That is the thing. And there we are, the allopathic side, it is there, surgery is the global spasm surgery is they are doing. And by that, it is, tremor will be moving, but the patient will become gloomy as it is. All the conditions, all the level. And dementia with the Lewy bodies, that is episodes. Syncope and that is episodes of fall. We can see if the dementia with the Lewy bodies, we can see it is a different condition compared to the Parkinson's, entirely different condition. That is, it is more attention is needed, and emergencies will be can be seen in these dementia with the Lewy bodies. Syncope will be there, and episodes of falls will be there, and PSP. And it is very mimicking the Parkinson's, and especially the rigid case of Parkinson's. And we are differentiating to the absence of eye movements. They cannot see, they cannot change the these people in different sides, because only fixed people will be there. So by that only, very easily we can differentiate the PSP. So these patients are coming to our OP. Of course, we have to rule out these conditions.
Is the key, sir?
Yes.
Okay, sir. Okay.
This is the protocol of Parkinson's, what I am doing, and this algorithm, and I think you are not able to hear. Just I am taking again, I am taking the completely picture. I will show you. Just I want to back to stop share.
No, sir, you can
Wait. I'll do that.
Sir, you have to start again, sir. It's not screen sharing.
Okay, I understood.
Okay, sir. Yes, sir. Now
Allah,
it's started.
Allah, no, it is not like that. And the algorithm I want to show that I will show you very clearly.
Okay, sir.
It is
Can I start screen sharing, sir? For
no.
you?
Sorry. No, just wait.
Oh, okay, sir. Fine, sir. We'll wait.
Sir, any difficulties?
Not sir, it is I want to again that my algorithm is in the very PowerPoint is open to see and anyway I
No
come
problem. Just you speak,
continue.
sir. It's okay.
So okay, I continue.
Yeah, you continue. Yeah.
Yes, yes. Is okay.
So you want to move to the next slide or this slide, sir?
Next slide. Next slide.
Next slide.
I'll go to the next slide. And this here, if your patient is admitting in the hospital, especially I am doing the treatment is based on the Panchakarmas. First I am giving the oral medicines, and after getting, I will show that. Then you can understand. This is the one case sheet. That also is not finally, I will show you. Okay. This patient is admitting the hospital and we are doing the if patient is able to do the vasti, patient is eligible for doing the kashaya vasti. I'm doing the yoga vasti schedule and I'm giving the kashaya is mahamanjistadi kashayam and belajidagadi kashayam I'm giving for that particular condition. Melagiragadi and Mahamajistadi Kashai is the drug many of the cases I'm giving. And other Rasaushada saying Rasarajasa, Siddhamardaja, Prahatmad Jindamani, Amarasundari, and Panjamata Loha Guru, Pradavalangesharas, and Pushpa Thandaras, and Tapia the Loha, depending upon the condition. So these medicines are available in the market and so these medicines are it is very available in the market and you see that I think many of the doctors are using these medicines also while in practice but particularly this group of medicine is depending upon the condition we are using that one. Okay, then it is the basmas, particularly basmas is rajada and I am avoiding the swarnam because of the cost. Of course, Swarna Basma may be having the result on the particular condition, but as the medicine, as the patient is needed for the longer time treatment, the economical status may not be agreeable with the continuation of the medicine, but the continuation of the medicine is needed. That is why I avoided the. I usually in my practice I am avoiding the Swarna Basma. Uh, that doesn't mean that it is Basma is not having the result. Maybe it is having the result, and practically I am not having the experience on this Swarna Basma. And Rajata Basma and Tamra and Kandaloha, Abrahavala Basma and Swarna Vashika and Shilajit and Pravala and Manikya. These are the medicines I am using the Parkinson disease. Depending upon the if patient is obvious, obvious, of course, then the Kandaloka is using. Other Kandaloka is also using. Otherwise, we are using the Rajada and Sokamarchi is add on the big whatever the medicine we are Tamra or Rajada we are using along with the Swarnamarshika and Pravala is also using. So making it combination with these basmas and along with Pravala or Shankha and with Ashwagandha Churna, we are mixing and we are giving these basmas. And another Nagula Thailam and Rajatavasma and Kabigachu. These are the many studies are conducted on this Nagula Thailam, and now it is not able to give the medicine because it is nobody is preparing as a name of Nagula Thaila, and it is we cannot use also this because of the legal issues. And Rajatavasma is using Kabigachu is also natural dopamine releaser is there. That is why it is Kabigachu is using, and you know that is a medicine. Most effective overall symptoms and a fine option for the initial therapy because this we are comparing the levodopa, of course. Levodopa in the levodopa is there, the dopamine releaser is there. Then only we can control the tremor. And usually medicines, allopathic group of medicines, levodopa with carbidopa, then only this absorption will be proper. Only levodopa we cannot getting the symptoms, pacifying the symptoms. And levodopa induce dyskinesia, reduce AD and kalyanakam. And gastroparesis is there along with the levodopa. We are giving the gandharastha, DIKSHA, manasa, mahavata, and erantathailam. And if the along the levodopa, we are siloria is there, mustan, kutaja is the best choice. And these are the complications we can see use of the levodopas, and patient may presenting these complaints. So at that time we cannot stop the levodopa. We are adding our supporting therapy into that. That you can understand. And psychosis, patient is having psychosis in the case overdose of levodopa, syndopa. That is Rajata and Abraga and Manasutravadagam and Atriadic rhythm we are using. If patient is having the constipation, of course, constipation is the main symptom we can see in the Parkinson's patient. We are using the Indugandham and plus Indugandham, Hingutruganam, and with Abhayashtam. Indugandham with the Saitava is first choice. And if it is not getting the proper effect on this body, then of course we are adding the Hingutruganam as a second choice, and Abhayashta is an add-on therapy in this condition. So on case sheet also I have two things. I'll total algorithm is present. So treatment schedule I'll show you definitely now itself. And these are the presentation in this one. Don't compare yourself with anyone in this world. This is my simple suggestion. And if you compare, you are insulting yourself. So you practice based on Ayurvedic theory and diagnosis Ayurvedic based on Ayurvedic theory. Then only we will be more confident on our treatment aspect. That only I'm thinking on this after these 22 years of experience. And I'm sharing some of the views only and with a very fast manner. And of course, thanks to this team. And if any questions are there, I'm ready to answer. And moreover, if any suggestions are there, I am agree to, we can see that. Okay, thank you. And I'll show meanwhile, I'll try to show the algorithm as well as the my case in the this Word file. Okay. Thank you, sir. Hello?
Yes, sir. Thank you, sir.
It's audible.
Yes, sir. Yes, sir. It's all.
Thank you, sir, for helping us through your comprehensive lecture. Now let's move on to question and answer session, sir.
आन्सर्स असतील ना हा पण गीता सरांना ऑर्डर सेशन आहे ना मी नंबर घेऊ का त्यांचा
So shall we move to question and answer session,
Yes,
sir?
of course, you can ask. I will try in between. That's only.
The Samshamanam, Deepanam, Pachana drugs looks little bit similar.
Samshamanam?
Deepana, Pachana drugs looks little bit similar.
No, it is not similar. Deepana Pajaniyam is coming only the calcium carbonate. Samshamaniyam is only the arsenic compounds.
Okay, sir. Thank you, sir. How can complications due to Rasha Aushadhi be treated, sir?
Complications. So, first of all, Shodhana and Marana should be proper. And this we have to purchase, otherwise we have to purchase the established and leading companies medicines. And while treating, you have to go through the vital functions. That means if patient is not eligible for taking these medicines, by seeing the diagnosis and the patient is having the any liver as well as the renal problems, and because these are the liver as well as the renal area is the area we are toxicity covering areas. So by if the patient is having these problems, so very carefully we are to administer the resources. And another thing is the medicines are many, and dose is very minimum. That is very carefully you have to give the medicines. At the same time, if you are giving the resources along with the gastroenterologist, you may be getting wonderful results. That is my principle. I am along with gastroenterologist only. I am giving only. I am not treating only with the resources. Many of the North Indian leading doctors, Ayurvedic doctors, physicians are treating only with the resources and getting the good results also. But I am treating along with the resources and Panchakarma. Okay.
Okay, sir. Thank you, sir. The Sashtavargam Kashayam is useful in neurodegenerative disorder.
Of course. Ashtavargam, Dhanayana, Mahamanjishtadi, these are the wonderful combination for using for the neurodegenerative diseases. And
Okay.
Daswana is very good full Dasana also. Daswana is Daswana Dikshayam, Dhanayana Dikshayam, Ashtavargam. These are three medicines, three Kashayas are which contains the Daswana. It's Lechuna. That is Lechuna is the one of the ingredient of this one. This condition. But only when you consider the Pitta Gova, if Pitta Prakriti patients as well as the Pitta Gova is there in this particular patient, I should not give these three Kashayas.
Okay, sir. Thank you, sir.
Okay.
Sir, there are some questions in chat box too. So shall I proceed, sir?
Of course, you ask.
Okay, sir.
Kapikatu in which form it is administered, sir?
Pardon?
Kapikatu in which form it is administered, sir?
Which form? It's powder form without usually if we are giving along with the milk, of course it is having some problem for digestion, and this dopamine releaser is not getting the maximal level. That is why better if you are having the kabigachu in the either tablet form or powder form with honey or with normal hot water. Better, because should not take with the milk because the dopamine releaser will be very delay and digestion will, because of digestion delay. So if you are giving this kabigachu to a seed powder, then better to give in the hot water or with honey. You can give.
Okay, sir. Anupanas in Rasa Ushadis.
Anumanas is the also these the Anumanas and Sahavanas. What is the meaning of means the use of the Anumanas and Sahavanas is to encourage the availability of the medicine. Means bioavailability of the medicines. So here the these, what is the difference between Kashtoshadis and Rasoshadis? These we cannot see if one medicine in Kashtoshadi, in one medicine is Brahmana. Of course, it is in Guru as well as the it is Snigdha and Guru, and not easy to digest. So we are adding the for Brahmana Drivya, just like some Chanaprasha. It is the Brahmana Drivya. We are adding the Prashavajurna for digesting that particular ingredient of that particular formula. Means for enhancing the bioavailability. But here in the rasa medicines, once it is Guru, Snigdha and Shida, and at the same time the Agneyamsha also there. You see, that is only one herbal drug, it is only ghee. Other than ghee, you cannot elicit any of the medicines in the herbal side. But we can see the many medicines and the Rasaushadis, that is the Guru and Shida and Snigdha, and along these three Agneyamsha. Gold is the wonderful drug and silver is the wonderful drug, and we can see that silver and acne has a luster in the particular things. So Brahmanam as well as Devanavajanam, and the both things you can see in same drug. That is very difficult to see in the herbal side other than the ghee. Okay. Hello?
Okay, sir. Guglu and Ballatakam with Rasaushidi combination, sir.
Which one?
Guglu and Ballataka
Ah.
with Rasaushidi combination.
Gugulu is Trayodasha Gugulu as well as the Mahayogaraja Gugulu. Mahayogaraja Gugulu is a wonderful combination with the 5 Rasausadas. 5 Rasausadas along with the Yogaraja Gugulu combination. This is the Sindura is also, it is there, silver is there. This combination is for especially in the spinal disorders as well as the Gridrasi condition we are using for this one, Mahayogaraja Gugulu, along with this Mahamajistari Kashayam or the Rasu Saptanga Kashayam combination. Then what you ask, Gugulu and Palladhaga.
Yes, sir, Ballataka.
Ballada is mainly using in the skin diseases and like that. And very Balladhagasvam, and it is available only one limited companies. You know any companies knowing the Balladhagasvam? Which company is having the Balladhagasvam? Anybody?
Sir,
Ayurveda Rasashala, Pune, having the Valladhagasvam. One of the companies, and other companies may be having what I am purchasing from the Ayurveda Rasashala from Pune. Okay, so Valladhagasvam and Valladhaga Chiram is the combination, and I am not using the Valladhaga with along with the Rasausadas, mixing with the Rasausadas I am not using. Okay.
okay, sir. Thank you, sir. We are very much gratitude for this wonderful session, sir. Now, I invite Dr. DIKSHA PR, Assistant Professor, Department of Samhita and Siddhanta, Ayurveda College, Coimbatore, to deliver the vote of thanks.
Very good evening to one and all. It's my privilege to have been asked to propose vote of thanks on this occasion. On behalf of Ayurveda College, Coimbatore and the entire Samsiddhi team and my own behalf, I extend a very hearty vote of thanks to all who have helped us in making this webinar a grand success. First and foremost, it's my privilege to thank my beloved Guru, Dr. Girish Krishnan, for your very thought-provoking and interesting sessions, sir. We have been fortunate enough to have one of the eminent personalities from Ayurveda with us here. I am sure that the participants are immensely benefited by being here. Your years of clinical experiences and understanding, your depth of knowledge and your ability to present the subject in such an interesting way produced one of the most memorable evening for all of us, sir. Your words gave us a close look at the practical approach on neurodegenerative diseases and the utility of Rasaushadhis on the same. Thank you, sir. We are all inspired by your great words. As no program can become successful with a single person, so I extend very big thanks to our whole Ayurveda College family for their support and teamwork. We are all most grateful to all the guests and participants here. We thank you all for being with us this evening. It's been a great pleasure. Thank you one and all.
Thank you, Girisha. Thank you very much.
Sir, once anyway.
Namaskara, sir. It was nice. Thank you so much, sir.
Yes. Anyway, nice to meet you.
Same here, sir. We'll cut up.
Okay. Okay.
Take care.
Can I leave?
Thank you.
Okay, sir.
Yes,
Thank
sir.
you, sir.
Good night. Thank you.
Samsiddhi 2020 is a success of 20 great sessions so far, and the time has come to draw a curtain to our program as we come to the close of it. Vidya Amritam Ashrite, attaining enlightenment through knowledge. We hope that our session aids you all in learning something new every day, ultimately helps in attaining success. A wise man will make more opportunities than he finds. Here, we have made the greatest opportunity to have Ayush Secretary Dr. Rajesh Kotecha as our chief guest of our valedictory ceremony on August 10 at 4 p.m. Be wise and don't miss. Everything begins with an idea, and idea provokes imagination. Imagination thrives for improvement. Let us have an idea about Avastha Vidhanameva Chikitsa, the heart of Ayurvedic approach to treatment, by Dr. Ram Manohar, on our next Samsiddhi webinar on August 10 at 5 p.m. To know more about our updates, do stay connected with our social media platforms. That's all for today, members. Have a wonderful evening ahead. Thank you.